Breastfeeding your infant can be a beautiful experience, but good support is essential. I'd like to review why breastfeeding is recommended, some common difficulties and tips for success, and how UC San Diego helps support women who choose to breastfeed. There are benefits to both mom and baby for breastfeeding. For baby, human milk is the optimal source of nutrition. Breast milk has proteins that help protect the baby against infections, help promote baby's digestive tract to mature in a healthy way, and even reduce lifelong chances of developing chronic diseases such as obesity, diabetes, some allergic conditions, and even some childhood cancers. For moms, breastfeeding can help reduce the risk of developing breast, ovarian, and endometrial cancer or diabetes. Mothers who are breastfeeding burn significantly additional calories daily, helping with postpartum weight loss, and may save up to $2,000 annually on formula costs. Most common difficulties. Inadequate milk supply. Often women may perceive that their baby is not getting sufficient milk due to constant demand from their infant. It's important to keep in mind during the first week of life, it's normal for an infant to nurse up to every 1 to 2 hours. This does not require supplementation with formula, and it's a natural process to help stimulate the production of sufficient milk. By 4 weeks after delivery, nursing usually decreases to every 3 to 4 hours. I encourage women to work closely with their pediatrician to monitor their baby's diaper output and weight loss to identify if there is truly a problem with milk supply. If you know what to look for, it's easier to trust your body to make the sustenance that your baby needs and avoid unnecessary formula supplementation that may reduce your milk supply. Babies also have growth spurts every 2 to 4 weeks during the first few months of life. If you notice that your baby has increased the frequency of feeds for 2 to 4 days, but is otherwise gaining weight well and having good amounts of wet and dirty diapers, this is normal. Your baby doesn't need an additional supplement. This is just the baby's way of telling your body that he or she is growing and needs you to produce more milk. Nipple and breast pain. Women frequently experience some nipple injury from poor latch or suck when a baby is first learning to nurse. Working closely with a lactation specialist can help during this process to minimize trauma to the breast. Women may also have pain from plugged ducts, infections, or engorgement of the breasts when too much milk is produced. Again, working with a lactation specialist and your obstetrics provider during your postpartum course can help address these issues. Maternal use of medications. Most medications are compatible with breastfeeding. Preterm or sick infants are at higher risk for medication toxicity, while infants over 6 months of age are at very low risk. It's important to discuss any medications you are taking with your pediatrician and your obstetrics provider. UC San Diego Hillcrest and Jacobs Medical Centers are baby-friendly hospitals. This means that UC San Diego Health Hospitals have been verified to meet the highest standards of supporting breastfeeding for patients. This includes fully trained staff, lactation support teams, keeping mothers and babies together by rooming in, and whenever possible, immediate skin-to-skin, and avoiding practices that can interrupt the natural breastfeeding cycle, such as routine use of pacifiers, bottles, or formula samples. Your obstetrics provider can order outpatient lactation follow-up care for additional support once you are at home with your baby. Often this is covered by insurance if it's ordered by your health provider. Here are some additional resources. It's always best to get support early on for any breastfeeding difficulties, but it's especially important if you or your baby have any warning signs. If you are experiencing severe breast pain or fevers, please call your obstetrics provider right away. If your baby is not producing the appropriate number of wet and dirty diapers for their age or is refusing to eat, please call your pediatrician immediately. The more you know about your choices for feeding your infant, the more empowered you will be to choose what's right for you and your baby. Here at UC San Diego Health, we're glad to be able to support you and your infant during this important part of your journey together.